Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Understanding typhoid vaccines. Typhoid vaccines prevent typhoid fever, a potentially fatal bacterial infection. While typhoid vaccination is not a routine immunization for people in the United States, it is recommended for anyone visiting parts of the world where typhoid is endemic, regularly occurring, /r/n/r/n. There are two available typhoid vaccines, Typhimvi and Vivotif. Both have mild side effects, which usually resolve on their own. Severe reactions following typhoid vaccination are /r/n/r/n. Typhoid vaccines are not routine vaccinations in the United States. They're only recommended for /r/n/r/. No country requires a typhoid vaccine, but the Centers for Disease Control and Prevention, CDC, recommends it for people traveling to areas where there is a known risk of S-typhi exposure. This includes parts of :r/n/r/n. If you're planning an international trip, visit the CDC's Travelers Health website to check the vaccination recommendations and travel advisories for your destination. /r/n/r/n. Typhoid fever is an infection caused by Salmonella typhi bacteria, which is often transmitted through water or food. When someone eats or drinks a contaminated food or beverage, the bacteria spreads in their bloodstream and causes typhoid fever. /r/n/r/n. Fever is the most common sign of this infection. Other symptoms include /r/n/r/n. Without treatment, the fever from a typhoid infection can last for weeks or months and lead to severe illness and even death. /r/n/r/n. Typhoid vaccines stimulate the production of immune cells called antibodies. These cells recognize the bacteria if it enters the body and prevent it from establishing an infection. /r/n/r/n. Typhoid vaccines are not 100% effective in protecting you from infection, so you still need to take standard precautions when visiting areas where typhoid fever is common. This includes avoiding untreated drinking water, avoiding raw fruits and vegetables, and frequently washing your hands. /r/n/r/n. Your healthcare provider will help you decide which typhoid vaccine is best for you and/or your child. There are two options available in the United States. /r/n/r/n must be given by a health professional. /r/n/r/n requires one dose. /r/n/r/n cannot be used in children under 2 years. /r/n/r/n can be used in immunocompromised people. /r/n/r/n must be given at least 2 weeks before travel. /r/n/r/n revaccination needed every 2 years for those who remain at risk. /r/n/r/n you take it on your own. /r/n/r/n requires 4 doses over 7 days. /r/n/r/n cannot be used in children under 6 years. /r/n/r/n cannot be used in immunocompromised people. /r/n/r/n series must be completed at least 1 week before travel. /r/n/r/n revaccination needed every 5 years for those who remain at risk. /r/n/r/n certain people may need to delay or avoid typhoid vaccines due to health risks. These include /r/n/r/n. Tell your healthcare provider if you are pregnant, breastfeeding, or planning to get pregnant to make a fully informed choice about typhoid vaccination. Neither animal nor human studies have been conducted to assess the safety of Typhimvi or Vivotif during pregnancy. However, the benefits of the vaccines may outweigh the potential risks. /r/n/r/n Typhoid is administered by a healthcare professional via intramuscular injection to either the deltoid muscle of the shoulder or the upper part of the outer thigh. Vivotif is packaged as a blister pack of 4 pink and white capsules. It must be kept refrigerated, and taken every other day 1 hour before a meal. /r/n/r/n Typhoid vaccines decrease in effectiveness over time. Periodic boosters are recommended for international travelers who frequent endemic regions. General recommendations are as follows: /r/n/r/n to ensure ample protection, an injected typhoid vaccine should be given at least 2 weeks before departure to an endemic region. If someone is using the oral vaccine, the series should be completed at least 1 week before travel. /r/n/r/n side effects can occur with either typhoid vaccine, but they're more common with Typhoid, affecting as many as 1 in 6 people. With both vaccines, side effects tend to be mild and resolve on their own without treatment. /r/n/r/n severe reactions including the potentially life-threatening allergy known as anaphylaxis are rare with typhoid vaccines. A review of studies in the Journal of Allergy and Clinical Immunology reported no cases of anaphylaxis out of 164,483 doses of typhoid vaccine administered. /r/n/r/n The following are the most common side effects for each vaccine. /r/n/r/n injection site tenderness /r/n/r/n injection site pain /r/n/r/n malaise, a general feeling of discomfort /r/n/r/n headache /r/n/r/n myalgia, muscle pain /r/n/r/n nausea /r/n/r/n diarrhea /r/n/r/n abdominal pain /r/n/r/n nausea /r/n/r/n headache /r/n/r/n fever /r/n/r/n diarrhea /r/n/r/n vomiting /r/n/r/n rash /r/n/r/n certain drugs and treatments can interact with Typhoid and Vivotif. These include the following: /r/n/r/n Vivotif can also interact with anti-malaria drugs like chloroquine and mefloquine, both of which can impair the effectiveness of the vaccine. The interaction appears to be mild, but inform your healthcare provider if you are taking or planning to take anti-malaria drugs before starting Vivotif. /r/n/r/n Typhoid vaccines significantly reduce a person's risk of getting typhoid fever. This infection is common in some parts of the world including areas in South Asia, East Asia, Africa, and Latin America, and it can be fatal. /r/n/r/n If you're planning a trip to an area with high levels of typhoid fever, talk to your healthcare provider about vaccination. There are 2 options available in the US, an injectable and an oral medication. Each has only minor side effects, such as headache and nausea. /r/n/r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.